President Donald Trump's One Big Beautiful Bill continues to make noise as it moves through Congress. It includes many changes, including tax cuts for wealthy earners, reductions in food stamp benefits, and the biggest cost cutter is changes to the Medicaid program. Republicans argue this won't hurt people who rely on it, but others say this could affect much more than just people enrolled in the program. Today, we're taking a closer look at how federal changes could affect Medicaid in Missouri. We begin our story in Boonville, where Medicaid came into a family's life unexpectedly, but with open arms.
And he just has a really calming, beautiful effect on, he's just a little magic baby.
Meet 5-year-old Sebastian, whose family calls him Bash. Kristen O'Brien and her husband adopted Bash after first bringing him into their family as a foster child.
He was on oxygen, thyroid condition, heart condition, brain anomalies, many things, medically complex and developmentally delayed.
O'Brien learned Bash has an extremely rare genetic disorder called Cat6B. When the O'Briens picked him up from Children's Mercy Hospital in Kansas City, he was just 6 months old.
When we are at this major hospital in Kansas City, and I said to the doctors, so, how many patients with this have you treated? And they said, we've never met a child with this. I'm in a room with 8 specialists, and they say this to me. So everything about this has been not what we anticipated, but it's been the right move at all times.
Bash was automatically enrolled in Medicaid through the foster care system and has remained enrolled since the O'Briens fully adopted him.
Medicaid is a lifeline to him. It gets him what he needs to be alive.
A lifeline that helps the family pay for most of Bash's health care, including more than 6 different types of therapy and 60 hours of in-home nursing care each week.
He's got like 18 or 19 specialists, probably the last time I counted. There might be more on the list now.
Who Bash is able to see because Medicaid pays for it. But the future is uncertain. Congress is debating the One Big Beautiful Bill Act, which includes sweeping changes to the Medicaid program. The most substantial are new work requirements for able-bodied Medicaid enrollees between the ages of 18 and 64 to work or volunteer for at least 80 hours per month. There are exceptions to this, including people with serious medical conditions and dependent children, which should include the O'Briens. But that doesn't mean these new changes won't affect them.
There's a lot of red tape. And enrollment's just the one step to get coverage on any item that he requests is a whole process. It's not just doctor's appointments and therapies. We have to go through multiple durable medical equipments, DME companies, to receive the equipment that he needs, a specialized chair to be able to sit at the table and practice eating, any mobility device, special things to help him hold a toothbrush, and special things to help him eat.
All things the O'Briens have to individually apply for in order for Medicaid to help pay for it. These new work requirements also include mandatory verification of employment twice a year. That means more administrative work on top of what can already be an overwhelming amount of it.
All I'm seeing out there is talk of adding more paperwork, and I'm like, where are you going to put these papers? On whose desk?
So that's the concern that a lot of people have.
Timothy McBride is a professor of health and public policy at Washington University in St. Louis. He says additional administrative requirements could have unintended consequences for Medicaid enrollees who are already working.
They have to know that they have to do it. And so how would they know that? They might get a letter, they might get notified by email or whatever, and they have to respond to it. They have to be able to figure out how to do the reporting. It might be on paper, it might be online. That's fault line number 3, which is, do you have online access in rural Missouri or wherever you are? And then can you figure out the forms? God bless our state, sometimes the forms are not that easy to figure out. And then even if they get the forms submitted, will the state process it?
But this effort might all be worth it if it cracks down on people taking advantage of the Medicaid system. Research, however, shows that's a slim percentage of Medicaid participants.
And if you look only at sort of the non-elderly and take out the children, take out the people who are over 65, because of course, hopefully we were not going to make them work, then most studies suggest that about 10% of people might not be working who are on Medicaid.
In 2023, the Kaiser Family Foundation, an independent health policy publication, found 92% of able-bodied people on Medicaid under the age of 65 are already working. State lawmakers in Georgia and Arkansas have already implemented additional Medicaid work requirements. The nonpartisan Congressional Budget Office examined the effects of this in Arkansas. It found new work requirements did not increase the amount of people in the workforce there. However, it did increase the number of people who are uninsured. Still, some of Missouri's congressional delegates argue work requirements are a must, while one of Missouri's U.S. senators has firmly stood up for Medicaid benefits. The United States House of Representatives passed its version of President Trump's expansive spending bill last month, which could significantly cut funding for Medicaid. Now in the Senate, Josh Hawley has been one of the most outspoken advocates for protecting parts of the Medicaid program. I spoke with him about where the bill stands in that chamber and whether he and President Trump see eye to eye on it.
What matters is protecting Medicaid benefits to the people of Missouri who need this program, who qualify for it, who are working people, and have got to have Medicaid in order to pay for their kids' health insurance.
Hawley has defended Medicaid programs for children, the elderly, and people in nursing homes as ardently as anyone on Capitol Hill recently. But he has also defended new Medicaid work requirements.
I'm all for work requirements. I think that if you're able-bodied and you can work and you're not, you need to be. So this isn't a welfare program. Medicaid's not welfare. Medicaid is social insurance. People aren't on it because they're lazy. They're on it because they need it.
And evidence shows most able-bodied people on Medicaid already are working, backing up what the senator said, but also bringing into question why new work requirements are even necessary.
I'm sure there's waste and fraud that can be cut. There is everywhere. And I'm sure, sadly, that there are illegals on the program. There are everywhere, so we should cut that.
Republican Congressman from Missouri and former physician Bob Onder agrees.
I can tell you there is a lot of waste, fraud, and abuse in the Medicaid program. But what the big, beautiful bill did not do is cut Medicaid.
Independent research does not show systemic problems with waste, fraud, and abuse in Medicaid. The Congressional Budget Office estimates this bill will take away $793 billion in Medicaid funding over the next decade. Additionally, the Missouri Budget Project estimates 90,000 Missourians will lose health coverage if this bill passes. Hawley says he's spoken with the president about not including any additional Medicaid cuts in the bill. But amid his shifting policy decisions on items including tariffs, I asked the senator how confident he is Trump remains firm on this.
Oh, he's been very clear on this and very consistent on it, always. I mean, he campaigned on it. No cuts to Medicaid, Medicare, or Social Security. No benefit reductions, nothing.
Hawley also expressed concern for rural communities, where he and the president have received some of their most consistent support. Coming up, we visit a rural critical access hospital to see how Medicaid cuts could impact small-town hospitals across Missouri. About 8% more people rely on Medicaid in rural Missouri communities than urban ones, meaning rural hospitals usually see more Medicaid patients. As Congress debates potential cuts to the program in President Trump's spending bill, I went to Herman to find out how this could affect small Missouri towns.
Oh, it would be untenable.
Bill Hellebush is the CEO of the Herman Area District Hospital. It's a critical access hospital, which means it receives additional Medicaid assistance designated for rural hospitals. Hellebush says about 10% of the patients who visit his hospital are enrolled in Medicaid, which is less than most rural hospitals in the state. He's concerned about the burden the hospital in Herman and other small towns might have to bear if people lose Medicaid coverage.
For everyone that loses health care, if they need to be seen or their child needs to be seen, they're going to take their child or themselves to the nearest ER. So we're still going to see those patients. We don't turn them out in the cold. It's just that already stretched hospital, critical access hospitals like ourselves, we're going to shoulder that burden because we will see those patients for sure.
Federal law requires hospitals to see people during emergencies, but if they lose insurance and can't pay, the hospital often absorbs the costs. This is particularly concerning for rural hospitals in Missouri, as research shows nearly 1 in 5 are at risk of immediate closure. Hellebush explained the Herman Area District Hospital was operating at annual losses of $1.6 million. He says operations are improving, but even a 1% reduction in payments could be devastating.
Critical access hospitals have been closing for the last couple decades because we don't really have the support system or the network enjoyed by a lot of PPS systems. And you don't have the buffer to absorb any financial hits to your book any.
Hellebusch says people would have to travel about 80 miles to find the next nearest emergency room if his closed, which could be the difference between life and death.
It was just 2 years ago now that we had officer-involved shooting here in Herman.
In March of 2023, Herman Police Detective Sergeant Mason Griffith and Officer Adam Sullentrup were shot in the line of duty. Both men were taken to this hospital. Griffith tragically died, but Sullentrup survived.
And Officer Sullentrup, I don't think I'm speaking out of turn. If this hospital wasn't here that night, I don't think he's here today.
The impact of hospitals in rural communities extends beyond life-saving medical care.
Most critical access hospitals, if you look over time, are the largest employer in their town, much like us. You're as a small community, you're blessed to get a hospital. You know, you need your church, you need your school. Those are great things. You want to really thrive, you open up the hospital, it's just gravy. You see church, school, hospital, and communities thrive. They blossom from that. Unfortunately, in the early and mid-2000s, you saw a lot of these small critical access hospitals close. And I hate to be dramatic, but the town kind of goes with it. You know, they lose population, they lose commerce and business. Before, you know, the next thing you know, it could be a gas station stop and a few houses in a small, struggling type community. It's not just the hospital at that point. We're the lifeblood of the community.
And if the community struggles, it can make finding work in rural areas even more difficult for people on Medicaid.
In Jefferson City, we have a bus system, right? It's a lot easier to get around. Well, try Lynn, Missouri. Even down in Russellville, it was a lot harder for them to get to the more urban centers here locally.
Heidi Lucas is the executive director of the Missouri Rural Health Association. She says it was difficult to help people in small towns find jobs when she was a caseworker.
Also, sometimes in our rural communities, there just might not be enough places for them to apply for. That was something that we ran into a lot. There's only so many times you can apply to McDonald's or Safeway.
But it's not just rural communities that could feel the impact of stricter Medicaid work requirements. A public policy economist at Washington University in St. Louis says if hospitals expect to lose more money on Medicaid patients, they'll try to find it elsewhere.
This is called cost shifting.
That could lead them to raise prices for privately insured people. Estimates show uninsured people cost insured people approximately $1,000 more for health care before the Affordable Care Act.
I mean, we're all going to pay one way or another. Maybe we'll save some money on the tax side for the federal and state government, but we'll just end up paying it through our premiums. That's the sad part. One way or another, we're going to pay.
McBride says experts have examined ways to effectively and equitably reduce Medicaid costs. Those include not using private insurance companies as middlemen to distribute Medicaid funds and trying to keep people out of nursing homes. That's one of the biggest government-funded healthcare expenses. And it's something Kristen O'Brien would like to see, whose son is disabled and relies on Medicaid.
My son is millions of dollars a year. We would be bankrupt if we had to pay for his health care.
O'Brien knows he'll need care for the rest of his life and says she hopes he will always get it at home. As legislation sparks uncertainties for many who rely on Medicaid, in her heart, O'Brien says she wouldn't change anything that led her to her son.
He came with a lot, but he's given us a lot. And yeah, he was meant to be a member of our family, and he had a lot of hardships, but he is definitely an overcomer of everything.
It's not only work requirements on the table when it comes to Medicaid cuts. Congress is debating whether to eliminate Medicaid provider taxes, which could cost the program hundreds of billions of dollars. For more information on those and further impacts the spending bill moving through Congress could have, visit our website, KOMU.com. President Trump says he wants to sign the bill by July 4th.